We have definitely seen an uptick in viral infections and bacterial infections going around this winter between the flu and COVID and RSV and all of the other things that we normally see during the winter season. And even as we transition into springtime, these illnesses still seem to be pretty prevalent. And among them are inner ear infections. We have seen quite an increase in them at the clinic here. So I wanted to talk to you a little bit about different types of inner ear infections and why I'm seeing people in the clinic with them. My name is Tress. I am a balance, vestibular, and concussion specialist and physical therapist, and I treat people with these types of disorders. Inner ear infections are actually the third most common cause of vertigo, so that sensation of spinning in adults, and that comes third to BPPV and Meniere's disease. I would venture to say that eventually that will fall behind vestibular migraine as well, but there's not complete data on that yet. But for right now, those inner ear infections, there's two different types. One is called vestibular neuritis, and the other is called labyrinthitis, and they share a lot of similar qualities and symptoms. So we're going to talk about the difference between the two, along with shared symptoms, treatment strategies, and how physical therapy can help with those. To be a little bit familiar with each of them, it helps to be familiar with the anatomy of the inner ear. The inner ear itself is made up of two different components. One is the cochlea. The cochlea helps us with hearing. The other part is the vestibular system. Those are 5 organs that help sense linear and angular movement and acceleration forces of the head. And the vestibular system is part of your overall balance system. So each of those the cochlea and the vestibular system communicate their sensory information to the brain through the 8th cranial nerve, which is the vestibulocochlear nerve. We are going to talk about vestibular neuritis first. As the name implies, neuritis is an inflammation of the nerve. So this is an inflammatory condition of the 8th cranial nerve, or that vestibulocochlear nerve, and it's typically caused by a viral infection. So this will produce symptoms of vertigo that come out of the blue, so it's a very sudden onset. But different from episodes of Meniere's disease or even BPPV, when you have episodes of vertigo that are lasting for typically 60 seconds or less, the vertigo that accompanies vestibular neuritis lasts for days, up to 3 days with a severe intensity, and then it typically starts to taper down from there on its own. This again is typically caused by a viral infection of that 8th cranial nerve. Along with that sense of vertigo, you can imagine the other symptoms that accompany it. So typically people will have complaints of nausea and vomiting, difficulty with their balance, oscillopsia, or a bouncing or moving of their visual field, difficulty keeping a clear visual field, so blurred vision, trouble scrolling through their phones or watching TV, things like that. And on occasion, this damage to the vestibular nerve can be permanent or diminished overall, but most of the time people will recover from this within 6 to 8 weeks. Now, there's a primary difference between vestibular neuritis and labyrinthitis. While vestibular neuritis is typically caused by a viral infection, labyrinthitis is typically following a bacterial infection. And the primary difference between neuritis and labyrinthitis in diagnostics and looking at symptoms is that labyrinthitis involves all of the structures of that inner ear, not necessarily the vestibular nerve. So when all of the structures in that inner ear structure become inflamed and infected, we're going to have all of those vestibular symptoms that we discussed a minute ago associated with vestibular neuritis, but we are also going to typically have hearing loss because of the infection interfering with the function of the cochlea. So the primary differentiation that we see between the labyrinthitis and vestibular neuritis is if hearing loss is present or not. Now, obviously, when these symptoms begin, we need to do a lot of differential diagnosis. A lot of people go either to their primary care physician or the emergency department, one, to rule out any kind of central pathology, so something going on in the brain that would be producing those symptoms. We obviously have to rule those things out, but also we want to make sure that this isn't the result of another process going on, such as Meniere's disease. So there are different tests that your physicians and vestibular therapists can use to help start to figure out what's what and what is causing your vertigo symptoms. The most common test that will give information immediately if it is central pathology or something going on with the brain, first is the HINTS exam, HINTS. That's an acronym for Head Impulse Test, Nystagmus, or an abnormal bouncing or movement of the eyes, and skew deviation, which looks at alignment of the eyes. If that test is positive, then a lot of times that indicates something going on with the brain that would be producing those symptoms. Also, of course, they would want to confirm that with scans of the brain itself. Once the cause of the vertigo is determined as being either vestibular neuritis or a labyrinthitis, medical management is certainly appropriate, either with antiviral or antibiotic medications if appropriate. A lot of times too, to help decrease that inflammation either of the inner ear system, the cochlea and vestibular system, or inflammation of that vestibulocochlear nerve, steroids will be prescribed for a short duration. That's obviously something that you would discuss with your primary care provider or your ENT, whoever you're working with for medical management of your symptoms. And then, of course, vestibular rehabilitation is oftentimes very helpful in recovering from these types of disorders. Now, again, these symptoms will start to improve typically on their own, but the brain can start to accommodate to this loss of balance and this impairment of normal vestibular function and reflexes. So seeing a vestibular therapist and working with a vestibular therapist will help restore normal vestibular function, help you accommodate if there is any permanent change or loss in your vestibular system following these types of illnesses, and get you back to all of the things that you normally like to do. So if you develop an immediate onset of vertigo that does not go away, please be sure to contact your physician and get on it with medical management right away. Ensure that it is not a medical emergency that is involving the brain, and then get to work with your vestibular therapist to get you back to all of your normal and recreational functional activities.